You do have to know these things too. Let me just cover the immune system in general, right? So your immune system is a lot of stuff, guys. It's your skin, it's your saliva, it's your gastric acids, but those are smaller details that you guys can brush up on. I want to discuss the main concepts, right? So we have immunity, right? We have two main subdivisions. The first one we call your innate immune system. And your innate immune system is what you're born with. It includes your tears, your saliva, your skin, your gastric acids, and what we call the natural flora of your cavities. So in your intestines you have good bacteria. In the vaginal canal you have good bacteria. In your oral cavity you have good bacteria. And so these are essentially your innate immune system. You're born with it. It's when you have an infection and your body increases its temperature, pyrexia, that's all part of your innate immune system. It's non-specific. Can we all agree on that? Mm-hmm. And then you have your specific, or what we call your adaptive immune system. This one's a little bit different. This one primarily deals with what we call T and B cells. Okay? Your adaptive immune system is very specific. If you guys get a specific illness, if you get a bacterial infection, a viral infection, your adaptive immune system will create antibodies, which are specialized white blood cells, to fight off that specific antigen. It's another word you guys have to know. You need to know that antigen is a foreign substance that enters your body. Bacteria, virus, protozoa, I don't care what it is, but it's a foreign substance. And then the antibody is what your immune system creates in response to the presence of that antigen. Now, notice that I'm talking a lot right now. It's more complex than your innate immune system. This doesn't care. My skin doesn't care if I have a cup of Charlie Sheen's blood with HIV on it and I pour it on my arm. It doesn't matter because my skin is intact. It'll stop from that virus entering my skin. Does that make sense? Mm-hmm. That's your innate immune system. But your adaptive immune system is different because it's specific. It produces specific antibodies, and those are specific white blood cells to fight off the specific antigen that's causing the issue. Does that make sense, ladies? Yes. Okay. That's the first thing you guys have to know about your immune system. On top of that, you have to know the specific terminology. We have something called active immunity, and then we have something called passive immunity. Active immunity means that your body creates the antibodies. Let me explain a little bit more what antibodies are. Your B cells, they're responsible for what we call your humoral immunity. Humor means fluid. Okay, humor means fluid. And so when your antigen, the substance that doesn't belong in your body, enters your body through a crack on the skin, whatever, I don't care if it's COVID, whatever it is, right? Your T cells, which are the shock collars, are the ones that activate all immunological responses, okay? These ones say, hey, look, there's this antigen, this foreign substance. And then the B cells, what they do, imagine you have the B cells, right? The B cells have these little elements extending from the cell. And what they do is, they try to find out what the hell this is. Is that earthquake? Okay. That's So anyway, so your B cells are the ones that actively produce these antibodies, okay? They find out what it is, and they create antibodies that are specific for that antigen, and then they usually circulate your body, and then the little antibody right here, it starts floating away, and it gets to whatever the pathogen or the antigen is, and then it stabs it, and then it destroys it. That's what antibodies do. So anytime your body is introduced to a foreign substance, the antigen, it creates the antibodies. We call that the antigen-antibody response. Any questions on that first? That's part of your adaptive immune system. Those antibodies circulate your bloodstream. And depending on the degree of exposure, depending on what the pathogen is, the antibodies can circulate your bloodstream for like a week, a month, 8 months, 10 years. It just depends on the substance, okay? When we talk about active immunity, we're talking about your body actually producing those antibodies. We also have something called immunoglobulins, which are in essence the same thing. active immunity means that your body produces those antibodies because it was exposed to something. Then we have something called passive immunity. That means that your body did not create those antibodies. Now, who gets the passive immunity? You ever consider when you're pregnant and your baby receives all of the antibodies that the mom has, that she's already acquired an immunity for, she gives those antibodies to the baby so the baby can survive against, has a means of survival against the most common pathogens that is in his or her environment. Does that make sense? Mm-hmm. So that baby, did that baby create the antibodies? No, the mom did. So that baby's immunity, we call that passive immunity because the baby did not create the antibodies him or herself. Does that make sense? Mm-hmm. Okay. Then we have another type of immunity. We call it either natural or artificial. Okay. Your natural immunity would be that example that I gave you guys with the baby receiving the antibodies, even though it's passive, but it's natural because it happens naturally. Or me, I got COVID last November, right? That my immune system that was activated, that was natural immunity because I encountered a foreign substance that I didn't prepare for, and I created those antibodies. But in that scenario, since I got sick, right? Naturally, that's natural immunity. Who created the antibodies against COVID-19 when I got sick?
You did.
I did. So is that active or passive immunity?
Active.
That's active immunity because my body actively produced the antibodies. Does that make sense? There is an immunoglobulin, a special protein with a white blood cell that can help you fight off certain substances. There's one for HIV. Now let's say I'm partying, right? And I engage in high-risk activity that increases my likelihood of developing HIV, meaning I have unprotected sex with a questionable character, right? And so at that point, if I know that I've engaged in that particular activity, I can go to the ER and they can give me a shot. You know what I'm saying? They can give me an injection. If they give me that injection, they're giving me an immunoglobulin that's supposed to fight off HIV virus, right? Is that type of immunity that I'm developing right now, is that natural or artificial?
Artificial.
It's artificial because I received an injection. And that antibody now, of course, goes in my body and divides and spreads. Is that active or passive?
Passive.
That's passive because my body did not create the antibody. Does that make sense? So you have to be able to distinguish those types of immunity as well. I have another one. Let's say that I also got the Moderna vaccine. Before I got COVID, you guys know that I got the vaccine like on a Tuesday. That's the first vaccine I got. And when my body created those, I was creating these antibodies, right? But is that type of immunity, me getting the injection, is that natural or artificial? Artificial immunity, right? And when it comes to my body producing the antibodies against the COVID-19 virus vaccine, is that active or passive?
Passive.
It's active. Because I got the vaccine. The vaccine is artificial. By the way, it has a protein of COVID-19. But who's creating the antibodies? I am. The immunoglobulin that I was talking about before, that's going to be your artificial, your passive. But if my body is creating the antibodies in response to an antigen, something that's being put inside my body, that's going to be an active type of immunity. Does that make sense, guys? Mm-hmm. Okay. So, are you vaccinated against the flu?
Yes.
You are vaccinated. So when you got the vaccine, right? Did you actually get the flu virus? Did you get sick, or did they give you a vaccine?
They give me a vaccine.
They give you a vaccine, right? Now, in that scenario, right, is that natural or artificial type of immunity?
Artificial.
Artificial. Now, when they give you a vaccine, they don't give you the antibodies, guys. They give you a protein with the DNA of that specific virus. So when your immune system sees that protein, what does it do?
Active.
It creates the antibodies. So who's creating the antibodies after that vaccine that they gave you?
I am.
You are. So that would be considered active immunity. Does that make sense? Mm-hmm. In this specific scenario of the immunoglobulin for HIV, they already give you the antibody. I didn't make it. My body can replicate it, but they didn't. I didn't make it. They gave it to me. And that's how it spreads around the body. That's considered passive immunity. Does that make sense, guys? Because so what I want you guys to focus on is who's creating the antibodies. If I get an injection of an antibody, well, that's passive. I didn't make it, and it's also artificial.
Question.
Yes, ma'am.
So what about colostrum for baby when they're drinking the?
Colostrum has a bunch of antibodies and a bunch of other great growth hormone
Would
and
that
other
be
good
natural
nutrition.
or?
That's natural,
That's it.
but that's good. It's passive. You're ready to be a teacher now. It's gonna be natural, but it's also gonna be.
I learned that in EMT.
That's good. I
How
failed that
long
class
does the
twice.
IG last?
It depends on the IG. It depends. The goal when you're giving the IG, when you have some type of exposure, including hepatitis B, right? If you prick your finger with a needle which is contaminated with hepatitis B, they'll give you an injection of an already created antibody, which we call immunoglobulin, and that is artificial, okay? And it's also passive. Does that make sense?
Can you explain the active and passive again? Because okay, the natural is what the body basically creates on its own that helps fight.
Natural means that it happens naturally, as opposed to, you know, her scenario that she got the vaccine for the flu? That's artificial.
Yeah, because it's being pumped into you.
That's correct. But if she actually caught the flu virus, she caught the flu, that's natural type of immunity when it comes to how do you contract it, right? And when it comes to the